You know, when we were talking about your research on major hemorrhage, one thing really struck me.
Okay.
That statistic about someone dying from an injury every 3 minutes,
Yeah,
that's just unbelievable. It really puts into perspective how important this whole issue is.
it really doesn't. When you think about the fact that major hemorrhage is one of the leading causes of those deaths, it makes you realize how crucial all these advancements in treatment really are.
Absolutely. And it really is a race against time, isn't it? 60% of those deaths, they happen within 3 hours of the injury.
Yeah,
I mean, it's barely any time to even process what's happened.
exactly. And that's why it's so important, I think, for us to make sure we understand like what constitutes a major hemorrhage,
Hmm.
because it's not just about how much blood someone's lost. It's also about like the body's physiological response.
Yeah, that's right. You mentioned a blood pressure below 90 millimeters of mercury,
Hmm.
or a heart rate that's over 110 beats per minute. And those are kind of key indicators. So what's actually happening in the body at that point that makes those markers so critical?
Well, think of it this way. When you've got a systolic blood pressure below 90, basically what that means is that the heart is really struggling to pump enough blood to all the vital organs.
Oh, wow.
And then when you've got a heart rate that's over 110, that rapid heart rate,
Mm.
that's the body, it's basically just desperately trying to compensate for the blood loss,
Mm.
it's trying to keep that oxygen flowing.
Mm.
So those signs are really telling us that, this is a really serious situation. This person's body is under a lot of distress.
And this can happen for all sorts of reasons too, right? We're talking about everything from, car accidents and other sorts of traumatic injuries, but then you've also got complications during surgery, childbirth.
Yeah.
It's incredible how the same life-threatening condition can come from so many different things.
Exactly. And that's one of the things that makes this deep dive really interesting, I think, because we're not just looking at one specific injury or one specific illness, right?
Mm.
We're kind of exploring a whole range of situations where major hemorrhage is a risk.
And I imagine each one of those might need a slightly different approach in terms of treatment.
Definitely.
So where do we even begin? I mean, back in the day, was it just a case of let's give them more blood and hope for the best?
Yeah. Yeah. Well, thankfully we've moved on quite a bit since then.
Yeah.
But you're right. For a long time, that was the main thought, like
Yeah.
just replacing the blood that had been lost.
I mean, it seems logical on the surface, but I'm sure it's much more complicated than that.
It is. It is. We understand so much more now about how, like, a major hemorrhage really affects the entire body. It's not just about the blood loss. It's kind of this cascade of effects that it triggers.
Okay, so let's break down that cascade then, because we're talking about a loss of red blood cells, which carry oxygen.
Yeah.
But there's more to it than that, right?
Right. You also lose clotting factors.
Okay. Yeah.
Those essential components that help to stop the bleeding.
Mm.
And then as the body kind of tries to compensate for all of this, it can tip into this really dangerous state. And this is what we call the deadly triad.
Yeah. The deadly triad, that sounds pretty ominous.
It is, yeah.
What exactly does that involve?
Okay, so it refers to this really dangerous combination of hypothermia, acidosis, and then coagulopathy. And they all kind of act together, which makes the situation even worse.
Okay, I think some of those terms might be a bit technical for some people.
Sure.
Could you maybe break down what each of those means?
Okay, so hypothermia
Mm.
is when the body's core temperature falls to a dangerously low level.
Mm-hmm.
Acidosis basically means that the blood is becoming too acidic, and that can really disrupt a lot of different bodily functions.
Right.
And then coagulopathy, that's when the blood's ability to clot is severely impaired. And this makes it even harder to stop the bleeding.
So it's like this vicious cycle. The hemorrhage leads to these other dangerous conditions,
Yeah.
which then, in turn, make it even harder for the body to recover. I can see why they call it the deadly triad.
Exactly.
But that leads us to the question of how has the approach to treating this evolved?
Yeah, so the key really
Mm-hmm.
has been moving away from that idea of just simply replacing blood to a more proactive and more holistic strategy. And we call that hemostatic resuscitation.
Hemostatic resuscitation. Tell me more about that.
So it's essentially about damage control. Yes, getting that blood volume back up is obviously very important, but we also need to maintain the blood's ability to clot properly and then try to prevent that deadly triad from even taking hold.
So it's about getting ahead of the problem, not just reacting to it after it's happened.
Exactly, yeah.
Okay, that makes a lot of sense.
Exactly.
And is that where these advancements that you were talking about come in?
Exactly that, yeah. One of the biggest advancements has been in blood transfusions,
Okay.
the way that we approach them now.
You were talking about advancements in blood transfusions.
Yeah.
And I remember reading something about a shift towards kind of earlier, more balanced transfusions. So what exactly does that mean?
So for a long time, The focus was mainly on red blood cells, just getting that oxygen back into the system.
Okay.
But we know now how important it is to use both red blood cells and fresh frozen plasma,
Right.
which contains those clotting factors that we were talking about.
So it's about replenishing not just the blood itself, but also the components that help it to clot properly.
Exactly.
That makes a lot of sense. But I understand there's been some debate about the ideal ratio of red blood cells to plasma, and that's something that comes up especially when you're comparing trauma cases versus non-trauma situations.
Yeah, you're right.
Can you tell me a bit more about that?
Yeah, so one of the approaches that's been talked about a lot is this 1.1.1 ratio,
Okay.
which is using equal parts of red blood cells, plasma, and platelets.
Right. And I remember when that pro-PPR trial came out, that was a really big deal.
Yeah, it was a huge.
It seemed like everyone was talking about it.
It was. It was everywhere.
What were the findings of that, and did it actually live up to the hype?
So the pro-PPR trial, it definitely got a lot of people talking.
Yeah.
And it did show that there were some potential benefits of using this 1.1.1 ratio, particularly for controlling bleeding during surgery. But
What?
the results weren't as clear-cut as people had hoped,
Oh, really?
especially when you look at overall survival rates.
So it wasn't the sort of magic bullet that some people were hoping for?
Not really, I think.
Okay.
One of the big takeaways from all of that research is that, the ideal transfusion strategy, it might not be a one-size-fits-all kind of thing.
Right.
It could depend on things like what kind of injury the patient has, their overall health, a bunch of different individual things.
Yeah, that makes sense. I mean, we're not all wired up in exactly the same way, are we?
Exactly.
But moving on from those ratios for a moment,
Sure.
one of the things I was reading about that really fascinated me was this research on pre-hospital plasma transfusions. I mean, getting that plasma to patients before they even reach a hospital. That just sounds like something from a movie.
It's amazing, isn't it, really? But it's so important
Yeah.
because in those first few minutes after someone's had a really serious injury,
Right.
every second counts.
Yeah.
So if we can give them plasma,
Mm-hmm.
which has all those clotting factors in it,
Yeah.
right there at the scene,
Yeah.
that can make a massive difference, especially for trauma patients.
Absolutely. That's remarkable. It makes you wonder what other sorts of medical innovations are just around the corner.
I know, it's amazing, isn't it?
But sticking with some of the advancements we've been talking about so far, I'm curious about the role of medication in all of this. What I find fascinating is we're talking about drugs that can actually help to control bleeding, to promote clotting,
Yeah.
that kind of thing.
And we've seen some massive advances on that front as well.
Yeah.
One that really stands out is tranexamic acid.
Okay.
And this has been a real lifesaver for people.
It's incredible to think a drug that can actually help to reduce deaths from major bleeding. How does that even work?
Through.
It might seem kind of magical, but it's actually really clever the way it works. So basically, when a blood clot breaks down, there's this substance called plasmin that's involved.
Mm-hmm.
And what tranexamic acid does, it inhibits this plasmin.
Okay.
So it basically stops the clots from breaking down.
Yeah.
And that helps to stop the bleeding much faster.
So it's kind of reinforcing the body's natural defenses.
Yeah, exactly that.
But it's not just for trauma, is it? I understand it's used for things like postpartum hemorrhage, and I think I read something about how there's even been research into using it for brain injuries.
Yeah, you're right, yeah. It's proving to be really useful in all sorts of different areas.
It's pretty amazing, isn't it?
It is, it is.
But it's not a cure-all, is it?
Not at all. No, and I
Well,
think...
I know you mentioned earlier on about that kind of 3-hour window.
Yeah. Is that right? Is that when it's most effective?
Yeah. Timing is absolutely crucial when it comes to tranexamic acid.
All right.
And it's worth pointing out that it's not as effective in some situations, like gastrointestinal bleeding.
Okay.
That's one where we don't really see the same consistent results.
So it's a powerful tool, but as with any tool, you have to use it in the right way.
Exactly.
Okay. And that leads me to another one of these essential components I was reading about, which is fibrinogen.
Right.
And as I understand it, it's almost like the building block for blood clots.
It is. Yeah, that's a really good way of putting it. Fibrinogen is absolutely essential for blood clotting.
Okay.
If you haven't got enough fibrinogen in your system,
Yeah.
you just can't form those clots that you need to stop the bleeding.
And we've got ways now of directly replenishing those levels, haven't we? Yeah.
With things like cryoprecipitate and fibrinogen concentrate.
Exactly. And they both contain fibrinogen. So they're both used to address low fibrinogen levels. But there are some subtle differences between the two.
Okay.
So cryoprecipitate, that's made from plasma,
Right.
and it's got other clotting factors in it as well as the fibrinogen.
Okay.
Whereas fibrinogen concentrate is kind of a purer, more concentrated form of fibrinogen.
So it's about picking the right tool for the job, depending on what that particular patient needs.
Yeah, absolutely. Spot on.
Gosh, we've covered so much ground.
We have, haven't we?
From the basics of what even is major hemorrhage
Right.
to all of these incredible advancements in blood transfusions and medications.
Yeah. It's really incredible to think about how far we've come in treating this, even just compared to a few decades ago.
Oh, absolutely.
But with all these advancements, I mean, are there still some big unanswered questions out there? Areas where we need more research, that
Yeah,
kind of thing?
for sure. Definitely. We always want to understand more. We
Yeah.
always want to get better outcomes for people. And one area where I think there's a lot of potential is in this idea of personalized medicine.
Okay.
So rather than taking a one-size-fits-all approach, can we tailor those treatments more to the individual patient in front of us?
That makes a lot of sense
Yeah.
because what works for one person might not be the right course of action for someone else. When you factor in things like their genetics, any pre-existing conditions,
Exactly.
and maybe even their age.
All of that, yeah. And then the other thing we have to think about is the economics of all this.
Right.
Because a lot of these drugs, these technologies that we're talking about,
Yeah.
they don't come cheap.
Right.
So we really need to find a way of making them accessible to everybody who needs them.
It's a tough balance, isn't it? Trying to sort of push the boundaries in terms of medical innovation. But then at the same time, we don't want cost to become a barrier for people.
Absolutely.
It's something to think about.
It is.
And what about the long-term impacts for people who've survived a major hemorrhage?
Right.
I mean, I'd imagine that,
Yeah.
surviving the event itself is one thing, but then there's a whole journey after that, isn't there?
Yeah, and that's another really key area
Yeah.
where we need more research. We're really just starting to understand what those long-term challenges are, the physical, cognitive, emotional challenges that people face.
It's not just about surviving the actual event. We need to make sure we can support people to make a full recovery,
Absolutely.
to reclaim their lives.
And that means really understanding those long-term impacts,
Yeah,
which is something that, thankfully, lots of researchers are looking into.
that's good to hear. I have to say, the more we talk about this subject, the more I realize how complex it is.
Yeah.
We started off talking about those really startling statistics,
Right.
the fact that this is such a big issue,
Mm-hmm.
but then we got into the sort of nitty-gritty of the body, how
Yeah.
these things actually happen,
It's fascinating.
and then all these amazing advancements.
It is.
Blood transfusions, medications.
Yeah.
We talked about tranexamic acid, fibrinogen replacement therapies.
Yeah.
But then we've also uncovered this whole other layer of, what do we need to research more?
Yeah.
Personalized medicine, that economic side of things.
It's a huge field.
Long-term care for survivors.
It is a massive
It's
field.
been a real eye-opener.
It has.
So as we kind of wrap up this deep dive,
Yeah.
is there anything, any final thought, a question, anything you could leave our listeners with?
So we've talked a lot about reacting to major hemorrhage, but what if? What if we could predict who was at risk
Right.
before it even happened?
Okay.
Could we intervene earlier? Could we even stop these things from happening in the first place?
Now that is a thought, isn't it?
It's pretty amazing.
That's a future I think we all want to be a part of.
I think so, yeah.
It's so important to remember that even though we've made all these advancements, there's still so much more out there to discover.
Absolutely.
It's been amazing to have you here to talk about this with us.
Thank you for having me. It's been great.
And thank you to everyone at home for joining this deep dive with us. It's been a real privilege to explore these important topics with you.